Welcome to the four-part video series on improving diabetes management and outcomes, presented by Superior Health Quality Alliance. This recording was developed for healthcare workers with an interest in providing care to individuals with diabetes. This fourth video will explain diabetes and transition of care best practices. The objective for this learning session is to achieve the following. Identify key best practices in transitions of care and patient outcomes. Our goal is after the video, you will have a better understanding of this topic and how it applies to your own healthcare setting. There are many studies that discuss the transition from the hospital to home. These best practices discussed in this presentation are founded on those studies. Transitioning someone to any level of care involves some common elements. The Minnesota Hospital Association has a Transitions in Care Roadmap, which highlights important expectations for patients, their families, and anyone involved in their care. Medication reconciliation needs to be communicated to the patient. The pharmacy should be involved, whether it's an internal pharmacy or a contracted pharmacist. And this is to ensure medications and doses are correct and that there are no harmful interactions. This information should be included in the discharge orders that the patient can take with them. Safe transitions of patients involves representation from across the healthcare system. Care teams, including the interdisciplinary team, need to communicate and meet internally on a routine basis. Externally, this will be driven by the healthcare home model or the case manager. Measuring and tracking data is also important for any process or program. Unless we measure, we don't know how we're doing. Anecdotal evidence isn't enough. Data is essential. Tracking data can include readmissions to the hospital. A transfer record should include the patient's preferences, priorities, goals, and values. Understanding what motivates the patient is crucial when transitioning them to home health, rehab, or another subacute setting. Their belief system needs to be known and respected. It's vital to develop a comprehensive discharge plan. Consider having a discharge planning committee, as it plays a crucial role in patient care options and outcomes when transitioning from one level of care to another. To ensure that all necessary information is included in the discharge plan and communicated promptly. Including a soft handoff, a recommended best practice, is also important. For example, calling the receiving facility to make sure that they've received the records or they don't have any questions, or if the patient is going home, calling that patient a day or two after discharge to ensure they're doing okay. And before their discharge, contacting that patient's primary care provider to schedule a follow-up visit for the patient. Medication reconciliation is one of the most important parts of the discharge. It's essential to ensure that medications are correct to prevent potential patient harm. Patient and caregiver education should always be done. Use the teach-back method to ensure patients and caregivers understand the instructions. Avoid technical healthcare jargon, but use rather layman's terms to ensure information is clear. Open communication between providers is the best way to ensure all pertinent information is communicated and patients don't fall between the cracks. I interviewed someone who has worked in a home health agency for many years, and I wanted to know what she believed were the important pieces of information needed when a patient is transitioning out of the hospital or nursing home to their home with need in home care. The first thing she mentioned was up-to-date records, that they should have the most current medication list, the most recent lab results, immunizations, and last appointment with the primary care provider. It's important to know if a patient was recently diagnosed with diabetes, as this can affect the level of education needed and the ability of the patient to manage their disease. Finally, any complications or special needs should be clearly stated. Key takeaways and resources. In summary, here are some key takeaways from today's presentation. Transitions of care from the hospital to all care settings should include regular meetings with the IDT team, medication reconciliation, which is a process to review and analyze the medications and doses. There should also be a data tracking system in place to ensure that the program is working and identify any potential flaws or gaps in care. And the transitions of care should also include information on the patient's needs, preferences, priorities, goals, and values. In transitions of care for older adults, be sure to use the teach-back method to ensure patients and caregivers understand the instructions. And avoid technical jargon to ensure the information is clear and comprehensible. Here are some resources cited in today's presentation. If you have questions about this video series or others, please contact us at info@superiorhealthqa.org. Thank you.